Tēnā koutou katoa. Good afternoon and welcome to the final day of COVID-19 Alert Level 4. I'll ask Dr Bloomfield to begin with an update for you all.
Thank you, Prime Minister. Kia ora koutou katoa. Today we have just one new confirmed case of COVID-19 to report, and there are 4 new probable cases. All of those cases today can be traced to a known source. 3 are linked to the St Margaret's Hospital and Rest Home cluster in Auckland, and 2 are linked to other known cases. In the context of our overall total, 6 cases which were previously probable have been reclassified as either still under investigation or not a case. So this means our current national total is now 1,469, and that's a net reduction of 1. The total confirmed cases is 1,122. This is the number we report to the World Health Organization, and it is also the number that many countries report publicly as their total number of cases. For example, Australia. So this number at the moment, 1,122, is the number that is comparable to those of other jurisdictions, including Australia. The reason why some of those probable cases have been reclassified is because public health units are working with us to review recent probable cases. Some of these, for example, have been classified as probable cases as part of a precautionary approach around clusters or existing cases, particularly over this last few weeks. This means then we identify close contacts and we put them in self-isolation while they are being investigated. We've found then in going back and reviewing those cases, especially in some instances where they have repeated negative tests, that they no longer should be classified as probable cases, and we will continue to do that over these next few weeks to help get a really good picture of what our total case number is. We will continue to report each day the number of confirmed and new probable cases and the net total. Yesterday there were 2,939 laboratory tests processed. Our combined total to date is 123,920, and the lower number of tests yesterday, as you all know, fits the pattern we do see on weekends. Of our cases, 1,180 are reported as recovered, an increase of 38 on yesterday, and this means around 80% of our cases are now recovered. Today there are 7 people in hospital, again unchanged from yesterday, and this includes 1 person in intensive care in Middlemore. Very sadly, we have 1 additional death to report today, which takes our total number of deaths related to COVID-19 to 19. A woman in her 90s who was a resident at St Margaret's Hospital and Rest Home died yesterday in Waitakere Hospital. Our thoughts are obviously with her family at this very sad time. This woman was a confirmed case of COVID-19 and had a number of underlying health conditions. She was one of a group of residents transferred to Waitakere Hospital earlier in the month and is the 3rd person from that cluster to have died. Her family have expressed their gratitude to the Waitakere Hospital staff who cared for their loved one. There are still 16 significant clusters, and again, this is no change from yesterday. We have only 1 case since the 1st of April where we are still investigating the source of infection. This is a confirmed case in Tauranga, and a possible link is still being investigated. A second case that was in Waikato that we had reported on in the last few days is now no longer considered a case. That person was a probable case, but following further investigation is no longer classified as such. Just a note on how we manage cases and close contacts under Alert Level 3. There will be ongoing strict isolation and monitoring around all confirmed and probable cases. All confirmed and probable cases will continue to be managed in quarantine or managed self-isolation if they are recent arrivals into New Zealand, or will be under strict self-isolation and active management if already in New Zealand. Active management of cases and self-isolation means there are daily phone calls to check on the health and welfare needs of people, including any symptoms they may have. And likewise, the same process happens with all close contacts. Daily contact is made to ensure they are undertaking the mandatory self-isolation for 14 days to check on symptoms and indeed any welfare needs they have. A new Health Act order comes into effect from 11:59 tonight when New Zealand moves to Alert Level 3. This new Section 71 notice under the Health Act is available on the Ministry of Health website and contains very detailed information about the constraints on activity under Alert Level 3 and also how permissions are granted for certain activities. And finally, just a reminder to people who have any health needs, and in particular those that are not related to COVID-19, please do not delay seeking care from your GP or through the Healthline number 0800 611 116. That is the regular Healthline number. And as usual, if it is an emergency, please do call 111. And if you get an appointment from your District Health Board in coming days for an investigation or to go in for treatment, please do take up that invitation. We can assure you that hospitals will be operating with everyone's safety in mind, including those of patients, families, and of course staff. Thank you, Prime Minister.
Thank you, Dr. Bloomfield. We are now 11 hours away from the lifting of Level 4 and of the strictest constraints placed on New Zealanders in modern history. It's been nearly 5 weeks living and working in ways that just 2 months ago would have seemed impossible. But we did, and we have done it together. Let me run through a few of the numbers that show how far we've come, the figures that we've been working towards in order to be able to confidently move to Level 3. Our testing has grown from obviously zero pre-COVID-19 to the capacity to process up to 8,000 tests per day. That's resulted in us having one of the highest testing rates in the world per capita. We have a very low percentage coming back positive each day, as low as 0.05% last week and only 0.17% today. This provides strong evidence that there is not widespread transmission that is going undetected. The virus has a transmission rate of around 2.5 in most places without controls. Under lockdown, this has dropped to 0.4, less than half a person infected by each individual. And for the last few days, our cases have been in the single digits, with, as you will have heard from Dr. Bloomfield today, just one confirmed case. It is worth pausing to digest those numbers. They are incredible, and they are thanks to the sacrifices that every single New Zealander has made. As we entered Level 4, modelling from Professor Sean Hendy gave us insights into a scenario in which we did not lock down. And in that scenario, our steady case numbers seeded an epidemic that potentially would have seen a period of as many as 1,000 cases per day. We will never know what would have actually have happened without our Level 4 restrictions, but we can look overseas and see that this devastating scenario has played out in many other countries. Through our cumulative actions, we have avoided the worst. Tragically, what we have been unable to stop is the loss of 19 New Zealanders to COVID-19. Numbers, of course, mean nothing to their family and loved ones, and nothing can take away their grief. All I can do or say again to those people is that our thoughts and sympathies are with you. We send them our love in their time of loss. As we do to anyone who has lost someone during lockdown and may have been unable to be with them or to farewell them as they would have wished. This has been one of, I think, the hardest elements of Level 4. Of course, the ambition we all have is to confidently reach the position where we can bring back the social contact that we all miss. But to do it confidently, we need to move slowly and we need to move cautiously. We must make sure that we do not let the virus run away on us again and cause a new wave of cases and deaths. To succeed, we must hunt down the last few cases of the virus. This is like looking for a needle in a haystack, and we need your help to finish the job we have started. There is no widespread undetected community transmission in New Zealand. We have won that battle, but we must remain vigilant if we're to keep it that way. That includes safely returning more New Zealanders to work, enabling more businesses to reopen, and allowing some of the recreational activities we've missed in the past 4 weeks. As you will have heard me say repeatedly, it is not and cannot be a return to pre-COVID-19 life. That day will come, but it is not here yet. To get there, our team of 5 million needs to have zero tolerance for cases to complete our goal of eliminating the virus at level 3. If you're unwell, stay home. If you have a runny nose, a sore throat, a cough, get a test. Let's make sure that we keep those testing rates up. We continue with our contact tracing and isolation. That's how we'll finish this job. As you know, we will be at level 3 for 2 weeks before Cabinet makes a further decision on next steps on Monday, the 11th of May. In order to consider a move to level 2, we'll consider the same factors we have for previous moves: continued extensive testing and what that's telling us, continuing with our rapid contact tracing, understanding exactly where each new case came from and how it connects to our existing cases, and confidence that we do not have undetected community transmission. I am optimistic that we can continue on a path of success, but let me be clear about 2 things. First, we can only do this if we all continue to pull together. And secondly, I will not risk the gains we've made in the health of New Zealanders, so if we need to remain at level 3, we will. Our priority, as it has been throughout these recent weeks, is the health of New Zealanders, because that's also the way that we can protect livelihoods. Of course, we've also put measures in place to cushion the economic impact by keeping as many New Zealanders in jobs as possible and by providing assistance to ensure as many Kiwi businesses as possible remain viable. We'll continue to do this, but I know what everyone wants is a return to the day when that is no longer required either. Before I conclude, a quick overview of how we'll be running the week ahead. Tomorrow, Cabinet meets from 10 a.m. The House sits Tuesday to Thursday from 2 till 6 p.m. with question time and other business, including a ministerial statement on Tuesday. Today will be the last day of the regular joint press conferences between myself and the Director General of Health. I know that many people around the country have regularly tuned in to receive information and advice during level 4. And so that's why I want to preserve my thanks for the day to Dr. Bloomfield. I consider New Zealand to be very lucky to have a public servant of Dr. Bloomfield's calibre leading the health response. His background in public health has meant I consider New Zealand to be amongst those countries who are lucky to have that expertise in leading our response, one that considers the health and well-being of New Zealanders in every respect. And so, Dr. Bloomfield, it's been a real honour. It won't be the last time you see us both up here, but the last of the regular times. And I thank the team that supports Dr. Bloomfield as well. From tomorrow, the Ministry of Health will continue their daily updates at 1 p.m. I'll return to my normal schedule of post-Cabinet press conferences and daily media stand-ups separately before the House. And most days there will be government announcements from this podium as we move through level 3 and increase our focus on the government's economic response to the virus. I anticipate at the time that we make announcements on whether or not we're moving from level 3 that again I'm likely to be joined by Dr. Bloomfield at that point. Finally, please remember the rules for level 3. And now that you have the opportunity, please, if you are taking part in a bit of contactless retail over the coming days, think about your local businesses. They need all our support. Happy to take your questions.
Prime Minister,
Jessica, yeah.
with the contactless tracing that you talked about last week, where are we at? Are we at that gold standard that you both talked about last week?
For contact tracing, we have scaled up a significant amount. We have the ability to make as many as 10,000 calls a day if that is required. Of course, what we want to do is make sure that we are as successful as we can be. So we can do our part with having the capacity. Now we're asking New Zealanders to do yours. Record where you've been, who you've been with, and that will make our job all easier. Dr. Bloomfield, you might wish to say more on that.
Yes, 2 comments, Prime Minister. One is I did have a full update from my team at the end of last week on progress with both the rollout and also the response to Dr. Verrill's recommendations, and they're progressing very well. And the second thing is I've asked them to invite Dr. Verrill back in during this week to talk her through what further action has been completed and just to get her further reflections and any further suggestions she has.
Are we at gold standard? Do you feel confident we can go into level 3 safely, like you said last week?
Yes, I do feel very confident we can do that, and there are 2 reasons for that. One is I've had my team out during the week visiting 3 of our public health units who have been actually at the forefront of some of the contact tracing, case management and contact tracing. And it's clear that they have scaled up considerably with that first amount of money that was made available, and they know exactly what that further they need to do to scale up. So at the moment, they can themselves trace 185 cases a day, and looking to scale that up to 300, and then being able to link electronically with our National Contract Tracing Centre and link all the data, including lab data and so on, through NHI number, will allow us to scale up to that target we still have of 1,000 cases per day if needed.
So yes to gold standard.
Yes, I believe we are at that point.
Close contacts of positive COVID cases has the Ministry been unable to reach?
In total, over the entire course of our action against COVID-19, in total, we'd need to go back and look at some of those details, keeping in mind that some of the probables that have been announced even in recent weeks have included individuals that we've identified after they're no longer symptomatic, and that's been part of our work as we've identified a confirmed case. They may have people in their household that have displayed symptoms that we then determine to be probable. And so sometimes, actually in those cases, the data around contact tracing will look like it has a long lag time, won't actually be an accurate reflection of what's happened in a household.
Yeah.
The average amount of time it takes to complete contact tracing for a confirmed case, to fully complete contact tracing for them?
Of course, we want that window to be as narrow as possible. So the goal that we're working towards, of course, is you're wanting that contact tracing to be in that first 48-hour period. But for that to be successful, it means someone needs to come forward very early on when they're manifesting symptoms. The turnaround of their test needs to be quick, and then the contact tracing around them needs to equally be very fast. You'll see from the fact that every day when we come down, we can describe to you where someone has contracted COVID from, that those first interviews happen very, very quickly. The success of reaching people around those cases will all come down to whether someone knows who they were contact with, knows their names, and we're then able to find them.
I just want to follow that up, Prime Minister. So what we've seen over the period of time is, and particularly as we've been in Alert Level 4, and we want this to continue into Alert Level 3, hence the importance of people recalling where they have been and making a note of that. Very early on, when we had the cases first arriving, contact tracing was much more difficult because people may have been in a range of different locations. And here's an example. We might have got an email at the Ministry that said, this person caught a bus from Auckland to Taupo with this company. And then there was a lot of work that would need to go on to find out with the company who else was on the bus to try and find contact details. Clearly that's been very different in Alert Level 4. And as we move into Alert Level 3 and the number of potential close contacts for people expands, it's very important that we understand so that if we do have cases, just who those close contacts are. And that's part of the reason we're stepping cautiously.
On that, are you concerned about creating new potential chains of transmission from all of these bubbles in Level 3 expanding?
And this is why I cannot emphasise this enough. With Level 3, there are new risks. People are going back into their workplaces, and that will extend the number of people they have contact with. That's why we ask that you still keep your distance as much as you're able from those who are in your workplace, and to reduce the risk further, make sure you stick to your bubble at home. We are opening up the economy, but we're not opening up people's social lives for the very reason that we need to reduce down our risk as much as possible.
We are extending bubbles though, aren't we? So for example, in a house of flatmates where someone's parents are now coming over and then another flatmate has a partner visiting, or another flatmate might just have a friend coming over, you're getting a whole lot of different groups.
And in those, you'll recall that we've said we want any extension to someone's existing bubble to be small. I would encourage anyone who's in a shared household, like a flatting situation, to think carefully about what that means for them. We're talking about necessary contact. We're talking about, for instance, a caregiver if you need, or if you've got someone in your life who is isolated and has had no contact with anyone else. But for a household like a flatting situation, they do need to think cautiously and act cautiously.
Bloomfield, can I ask why the Ministry stopped classifying cases as community transmission on the website?
Yes, what you'll see on the website is now we've got a different classification, because what's become important is and the Prime Minister's talked about this, is whether we know where the cases come from. And of course, as we've been in alert level 4, we've got effectively two types of cases. People who are arriving into the country from overseas who go into quarantine or self-isolation, and people who have become a case because they've been exposed to someone already here. And what we're doing now is classifying them so that we can give essentially more useful information about whether that has been the transmission from an existing case, either as part of a cluster or not, and where we can track back as to where the exposure might have happened, or whether we can't. And as I said earlier on, we've only got that one case since the 1st of April where even then there's a strong suspicion, but we can't necessarily trace where that infection happened.
Does that mean we're basically on the brink of elimination? And what targeted testing is done or is being planned for that time of the case?
Yes, that does give us confidence that we've achieved our goal of elimination, which never meant zero, but it does mean we know where our cases are coming from. And there will be ongoing focused and extensive testing through into alert level 3 and beyond, with two aims. First of all, to rapidly identify any cases, hence the importance of anyone with symptoms seeking advice and being tested. But secondly, that surveillance testing, which is will be targeted to, in particular, get good spread across geographical regions, different ethnic groups, and in particular workplaces like hospitals, like aged residential care, where essential, non-health essential workers like supermarkets may have exposure to a lot of people. So we'll be quite systematic about that testing, and there's a plan around that, and each DHB is currently providing us with their plans about how they're going to do that in their region.
Just clarify, do you mean that you consider COVID-19 now eliminated in New Zealand?
I would say
currently.
Well, what I would say is that our goal is elimination. And again, that doesn't mean eradication, but it means we get down to a small number of cases, and so that we are able to stamp out any cases and any outbreaks that might come up. And if you think about alert level 4, I would say we've achieved through alert level 4 the position we wanted to be into, so that we could now start to move down alert levels.
Is eradication a possibility in New Zealand?
It's a possibility. However, what we also know, and as we see with these ongoing cases, even after 4 weeks in lockdown, and I've said this before, this is a tricky virus, and that's why we're not going to reduce our vigilance one bit. If anything, we and other New Zealanders need to increase our vigilance to make sure we maintain our current state, because it's that will be directly impact on whether or not we can and when we can shift down alert levels further.
It's interesting when you see other countries, in particular who have got down to lower levels, or other places that have got down to lower levels, you see a tail. And that tail is particularly tricky when you get down to those small numbers in the same way that New Zealand is now. So as we've said, elimination means we may well reach zero, but we may well then have small numbers of cases coming up again. That doesn't mean we have failed. It just means that we are in the position to have that zero tolerance approach, to have a very aggressive management of those cases and keep those numbers low and fading out again.
How likely is that trans-Tasman travel bubble, and if it was feasible, when would that likely happen?
That's been discussed at a senior level between myself, PM Morrison, the Deputy Prime Minister and his counterpart. And I think what we all agree is that that is a situation we would all like to be in. But of course, our number one focus at the moment is making sure that both our countries are in the position where we're domestically managing COVID-19 to a point where we can, with confidence, open those borders. We're not yet, but we're keeping that in mind.
When realistically could that happen, and also could we see that extended perhaps to other Pacific Island neighbours?
Yeah, one thing I'm not willing to do is jeopardise the position that New Zealand has got itself into by moving too soon to open our borders up, even to Australia at present. That is something, though, that we absolutely are keeping in mind, that we'd like to work towards. But I think both countries need to feel confident that we can do that without putting at risk either country's health or economy.
Pacific Island nations.
I put them in the same category. We do have to be particularly cautious. Our Pacific neighbours in large part have not been afflicted by COVID-19, and the last thing we would want is to risk that.
What about opening New Zealand up to Australian citizens on the basis that they quarantine as New Zealand citizens do? Because they're Australians living in the country, their families can't visit.
And I see that as a very likely prospect. Of course, we're using quarantine at the moment to make sure that we can safely return New Zealanders. And if we're in a position where we're wanting to open up to New Zealanders, those who are living in Australia currently who wish to come into New Zealand but are willing to quarantine themselves, then that is something that we could consider. We need to keep in mind, though, constantly maintaining the capacity to do that safely and to do that well.
So on another Australia-related matter, they've launched the app in the last 24 hours.
Yeah.
Could we have an update on how the New Zealand app is going?
Yeah, so progress continues. I would point out that the Australian app, as I understand, is very similar to the Singaporean app. And I think one thing that globally we're seeing acknowledgement of is that it is not a replacement for human and one-on-one contact tracing between someone who works in our public health units and someone who has COVID-19. And that is because it requires a large proportion of your population to be using the app. And even if it has data between two people who have been in contact with one another, it picks up people at such a distance that you still want to verify. And some of the technology that's being talked about at the moment bypasses public health or health authorities. It means that you could potentially have people who are being told they need to self-isolate who may not have been in quite close proximity, and only human questioning will be able to determine that. So there are frailties with the system. We're still working on it. We want it to supplement what we're already doing. But the first phases of what you'll see in New Zealand will be the foundations rather than straight away the Bluetooth application. Sorry? Soon. But again, I'd say that don't expect the first iteration to include things like Bluetooth applications because there are other pieces of information that we think would be useful to support our contact tracing in New Zealand.
Minister, on universities.
I'll come to Jessica.
Prime Minister, on universities, what's your message to those universities who are still charging students but aren't actually using their rooms and halls of residence?
I haven't got a lot of detail on how often or how widespread that is, but one of the things that the message we have strongly been sharing to anyone who's in a position where they've got tenants, be they commercial or residential, is to apply compassion at this time. It is a tough period for everyone, and we want to see humanity in everyone's approach.
When you say compassion, you mean they shouldn't be charged if they're not there for students?
And I can't comment on individual circumstances, but that's been our general approach for those who are, for instance, calling on the resources of others who have been affected by COVID-19 or who might not, for instance, have the income at this time to meet some of the ongoing costs that they have.
Clarify a couple of things.
Prime Minister, Housing Minister Megan Ward announced over the weekend $107 million added funding for housing. She said in the PR, since the alert levels were put in place, more than 1,100 motel units have been secured for people living rough and homeless. This was secured by the government agencies. When looking to go down to level 2 and level 1, will the government consider utilising marae and financing marae to provide that accommodation, given that it appears to be a more cost-effective way to do it and also would benefit those local marae?
Of course, marae have been used in the past, particularly when we've reached crisis situations in the winter. What we've found is that, of course, through the impacts of COVID-19, our access now to housing options has widened. And so, yes, we have in the past used motels, for instance. Now we're able to access even better facilities than we have in the past. And we're housing a large number of people who have been chronically homeless who have not been housed before. The trick and the key for us will be maintaining that. That's been one of the small benefits of this experience has been our ability to get people into housing. We need to hold on to that, and I would expect our officials and departments to keep working with marae and others who traditionally have provided more than just a house, but wraparound service as well.
Dr. Bloomfield, can you confirm?
Sorry, can you just tell us what services hospitals are DHBs will be bringing back this week? And will that be up to individual DHBs to decide, or will they have steering from the ministry?
So I can speak to the second point. There is certainly clear guidance from the ministry, and we've been working on a daily basis with district health boards around that transition into level 3. There's quite detailed information on our website, not just about hospitals, but about other community-based providers and what services will be available and how people can access them. I guess the key principle for district health boards and their hospitals over coming days will be starting to move back to providing more elective and planned services, both outpatient appointments and also potentially surgery and other procedures, and then easing into that within the context of wanting to keep everyone safe. So making sure their infection prevention control procedures are all A1, and while still maintaining that ability, if necessary, to scale up a response to COVID.
Yes, I can clarify
about things like cancer diagnosis or existing conditions having deteriorated under Alert Level 4?
Well, there's no doubt that some people's care has been delayed during Alert Level 4, and that includes delay in the delivery of some procedures, including both diagnostic and treatment procedures. And there's been some excellent work done between Diana Safati, the Acting Chief Executive of the Cancer Control Agency, and clinicians across the sector about how to reduce the likelihood of any harm resulting from that, and in particular how to make sure as we go into Alert Level 3 that we can prioritise the investigations and treatment of people with cancer to make sure that they are getting what they need. And that work I think I'd commend, and it's also on our website.
I'll come back to you, Tova. I'll just make sure I grab a couple of extras.
Dr. Bloomfield, we're still hearing stories of asymptomatic elderly hospital patients unable to return to their rest homes because they can't get a COVID test, and some of them are spending weeks unnecessarily on the ward. Is the ministry going to change its advice or stance on this to resolve that problem? Actually,
what I'm really interested in is working out what it is we need to do to protect all people already within our aged residential care facilities and those who may be being admitted or readmitted after they've been to hospital. And so I've reached out to the Aged Care Association to look at a piece of work as we move through Alert Level 3 and into Alert Level 2 as to what we really do need to do in that setting. We'll have learnt a lot about what's happened over the last few weeks with our clusters in aged residential care facilities, not just about the residents but about staff as well, and how we need to support staff, including both at work and outside of work, to reduce any onward infection. And particularly around testing, what I'm really interested in too is not just whether or not testing not just testing of people before they are admitted, but given they all go into isolation for 14 days, and the pattern we've seen here is with some of our folk inside aged residential care who have tested positive but with no symptoms, as to whether it may be appropriate to do testing of these people during the time they are in isolation, and as well as that, do surveillance testing on other residents.
So specifically to those patients who are still on the ward and are thinking about going back into the rest homes, you're saying at the moment the solution is isolation for 14 days in that interim period and then working out something around testing?
Yes, so the isolation for the 14 days has been in place right through Alert Level 4, and we've agreed on that, and that's something that happens even if someone is tested because it's clinically indicated and if the test is negative. If it's positive, of course, then they're not admitted. If it's negative, then they still go into that 14-day isolation period. What I'm really interested in, and there's some paper just published in the New England Journal of Medicine about the experience in the US where they've got actually infection in 10% of their aged residential care facilities, is what ongoing testing is appropriate in this population, which is high risk and also may not display symptoms or be able to describe their symptoms.
Bloomfield, can I clarify a few things under
Jason,
level 3?
and then I'll come back to you, Tova.
Dr. Bloomfield, what do you make of suggestions by some leaders overseas that people should be injecting themselves with bleach to kill COVID-19?
Don't think I need to comment on that, Prime Minister.
No, I think probably we'll let your silence speak for itself. Tova.
It is worth asking about though, isn't it? Because there were cases
Is it?
After the President raised it, there were cases in New York where people were having to go to medical facilities because they had actually ingested disinfectants. And I know it's hard, you don't want to dignify this with a response, but can you maybe just send a clear message to people that obviously that's not the thing to do?
Indeed, under no circumstances should they even think about doing that.
I don't think we've had any suggestion of any reported cases in New Zealand of that occurring, and so that suggests to me that no New Zealander has listened to or given any credence to that suggestion.
The President said that at all?
Oh, obviously, here in New Zealand, we haven't seen that picked up, responded to, acted on in any way, and that's what we're, of course, here to do, is to look after the New Zealand population.
A few things on behalf of the people that have just asked us questions around level 3. People have been told to keep to their local area under level 3. How far can they drive to go to a beach or a park? Is it a 30-minute trip okay, or an hour?
Yeah, and look, the reason that we've asked people to stay regional, and that is a departure from level 4, is because people will have to travel to work. So we haven't given a specific range in terms of kilometres, because we do need to allow people to move to their place of work, and that will vary. But ultimately, we're asking for the same common sense that we did at level 4. Stay close to your home, act in a way that reduces risk. Think about what will happen if your car breaks down, you run out of gas, or you have an accident somewhere. So keep as close to home as you can, keeping in mind you'll need to access work and in some cases school.
Can people travel freely between their 2 bubbles as often as they like, and can they stay overnight?
Again, when it comes to that advice around bubbles, we're asking that people keep it small and keep it exclusive. So it may include a caregiver, for instance. And so that will mean that you've got an arrangement that will include those caring duties. And we need to allow families to be flexible with that, but keep it exclusive, keep it small. Remember, this is all about reducing your contact with others as much as possible.
So Dr. Bloomfield, there were new cases connected to the Rosewood cluster this weekend. Can you confirm that they include nurses?
I'm sorry, I don't have that information, but I will get that. And we'll
Prime Minister, are you looking forward to returning to the House tomorrow?
Oh, look, we've been really mindful all the way through of making sure that we, as much as possible, allow the ongoing scrutiny of the government and give the opportunity for the opposition to hold us to account, as is their duty. And so, actually, unlike a number of other places, we've moved quite quickly to reopen the House, but to do it in a safe way, in the same way that other New Zealanders are with their workplaces.
Can you give us an indication of any of the emergency legislation that will need to be passed tomorrow for COVID?
So basically what you'll see with some of the omnibus legislation that will come through is essentially it will just contain some of the things we've already announced. So insolvency measures, some of those tax changes. There's been other areas where we've delayed the need to renew licences and so on. So it's really just making sure that we can enact some of the things we've already shared with you.
Just 2 questions about level 3. What's your understanding of how many New Zealanders are going to effectively go back to work tomorrow over the couple of days? And secondly, I think a lot of what everyday Kiwis are looking forward to is the return of takeaways and not having to cook every night. And so I just thought I'd ask what you are looking forward to eating most now that level 3 restrictions are in.
We're expecting about 400,000 extra New Zealanders to enter into a workplace. Interestingly, though, that brings us up to a reduction in economic activity of about 25%. So that is a significant increase. But keeping in mind, we have managed to, of course, have people continuing to work in essential services through that time, and we've been able to do that safely. So we just ask that people continue with all of those lessons. In terms of the things that will be new, contactless retail and including takeaway services, for me, I think the thing that I'm actually looking forward to is really just the chance to support some small businesses. For my local walks, I walk up to Nakori Road and I see firsthand those cafes and places that have been closed down for a number of weeks, and I'm just looking forward to a chance to, like everyone, show them a bit of love.
Consideration in making our contact tracing app, when it's really compatible with Australia's, given the possibility of that?
I did have some discussion there with PM Morrison around the fact that, of course, they've used essentially the app that's come out of Singapore. And so there is similar technology being looked at and utilised. So we too have looked at the elements of the app from Singapore. So I imagine there may well be some similarities, but keep in mind, I think the number one consideration for opening up between New Zealand and Australia will be the fact that we have got COVID-19 under control. So the last thing you want is essentially just a shared system where we're all having to contact trace between ourselves because we haven't managed to get cases down.
Back in Singapore, it was thought to have needed 80% take-up to be useful.
Yes.
Have we done any surveys to see any appetite for New Zealanders to...
Yeah, and look, I have to say, from the outset, you will have heard us have enthusiasm for exploring technology to supplement what we're doing. But I remain a bit sceptical around what it's going to be able to deliver because the uptake has to be so high. If I have the app on my phone, it will only work well if every single one of you in this room have the app as well in order for them.
And say is we've had a number of cases in the last week or two where the person's infection and symptoms actually started before the lockdown, and then another person may have presented with some and been diagnosed, and we've backtracked and found those people whose symptoms started pre-lockdown, or they've had symptoms, recovered, and then become symptomatic again and have been tested at that point in time. And it's not clear whether their illness went away or whether they didn't have it in the first place. But the good thing is, as I say, since the 1st of April, so now nearly, over 3 weeks ago, 3.5 weeks ago, we've only got that one case, and even then we're quite confident about what the trackability is back to where the infection happened.
Could
Okay.
have been a reinfection then in that case.
Look, this is one of the big unknown questions, and you'll see this being considered globally, is whether people do develop immunity, how long that might last for if they do, whether they can be reinfected, whether someone tests positive and then some weeks later tests positive, whether that means they are still able to infect others or it's just a carryover of some viral remnants. These are all things we will be watching very closely because they will impact on how we now manage our way through Alert Level 3 and into Alert Level 2.
Okay, last question, Jackson.
Prime Minister, will David Clark remain as Health Minister until the election?
Oh, I've said that David Clark is our Health Minister and I have no intention to change that. Okay. Thank you, everyone.